Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Welcome back to the Endo Kids Podcast, where little hormones meet big answers. Today's episode is a continuation of our diabetes education series, and we're focusing on type 2 diabetes in children and adolescents. This is a topic that often comes with fear, confusion, and unfortunately a lot of shame. And our goal today is to remove blame, slow the conversation down, and explain what type 2 diabetes really is, why we're seeing more of it in kids, and how families can approach treatment in a supportive, effective way.
Absolutely. This episode is meant to be educational, compassionate, and empowering. Type 2 diabetes is serious, but it's also manageable. And in many cases, we can improve it with the right support.
So if you remember in our last episode, we talked about type 1 diabetes. Type 2 diabetes is different, and I want to explain a little bit about what that is. So type 2 diabetes is a condition where the body still makes insulin, but the body does not respond to it effectively. And this is called insulin resistance. So if you remember in type 1 diabetes, the body stops making insulin. But type 2, the body is making insulin, it just is not responding effectively.
And just to remind you as well, what insulin is a hormone that helps sugar move from the bloodstream into the cells. And like we said, in type 2 diabetes, insulin is present, it's there, but the cells don't respond properly. So the sugar stays in that blood.
And we often explain this as having a key that doesn't open the lock very well. So the pancreas responds by making more and more insulin over time, but it can't keep up because the body just doesn't respond as well.
And like Dr. Mehra said, this is very different from type 1 diabetes, where the insulin production stops completely. You don't have any insulin. But again, in type 2, you have it, it's just not working properly, or you don't have enough of it.
And we are seeing more type 2 diabetes in children for several reasons. None of them are about parenting failure. Okay.
That's a really important thing to emphasize. We know that genetics can play a major role in this diagnosis. And some children are genetically predisposed to this insulin resistance.
Right. And in some families, for example, almost everybody has type 2 diabetes. And so the chance of that child getting type 2 diabetes is pretty high because they're genetically predisposed to get it. Okay. Other reasons that children get type 2 diabetes is with puberty, pubertal hormones also increase insulin resistance naturally, and that can unmask type 2 diabetes.
There are other factors as well. So sleep deprivation, chronic stress, reduced physical activity, eating a lot of ultra-processed foods, and also we know there are some socioeconomic barriers.
Right. And this is a systems issue. Often it's not a willpower issue. There's a genetic component, and we are seeing more and more children with type 2 diabetes now.
Let's talk about symptoms and early signs. So some children will have symptoms such as increased thirst, frequent urination, fatigue, or blurry vision. And these are similar to the symptoms that we talked about when we spoke about type 1 diabetes.
Yes, and others are diagnosed during routine blood work before the symptoms appear, which actually can be a good thing because it allows us to intervene before they start to develop some of those symptoms.
One of the other signs that we can see is actually a physical sign, and we call it acanthosis nigricans, which reflects insulin resistance. And what we see is usually on the back of the neck it becomes a little bit darker, almost velvety even, and it just looks a little bit darker back there. And that's caused by increased insulin.
Right. I often tell parents it's not dirt that they have, because sometimes parents are having their children scrub their necks, and it's not dirt. It's really the overproduction of insulin that leads to what we call hypertrophy in some of the skin back there, growth of some of the skin cells back there. Important to recognize that if you see that in your child. And we can see that behind the neck, we can see it under the arms. Sometimes I see it on the knuckles or the hands, and really important to be able to recognize some of those physical signs. Diagnosis usually is made through blood testing and a blood sugar test called the hemoglobin A1C, which is a measure of your blood sugar over a 3-month period of time. And so we do evaluate that when we're worried about a child potentially having type 2 diabetes.
At the same time or after, we might do some more blood work, such as cholesterol or liver enzymes, and certainly checking a patient's blood pressure as well. We know that type 2 diabetes is often part of a broader metabolic picture, and we want to look at the whole body, the whole person, the whole child to get a sense of what's going on and to know how to treat.
Yeah, and this is really not about labels. It's really about understanding the risk and intervening early. And we know that early diagnosis can make a difference over the long term, both in lifestyle modification, sometimes medication or treatment. So really important to recognize that. Again, like Dr. Waldman said before, this is not a grade. It's us getting some information about what needs to be done and what kind of treatment needs to be done. And the treatment is really not about restriction or blame. It's about helping the body respond better to insulin.
Absolutely. And the beginning, we focus on family-based changes. So helping sleep, stress, movement, nutrition patterns. This is really isn't meant, like you said, to place blame or focus only on maybe one person out of the family. A lot of the changes that we talk about are great for absolutely everyone.
Yes. And we also prioritize sleep because lack of sleep also can worsen insulin resistance, interestingly. We focus on all of this and look at a more holistic picture.
And with that, movement also is about consistency and joy. It's not about punishment. So finding some type of movement or exercise that your child enjoys doing, this is not meant to be torture.
We focus on their nutrition, their exercise, their mental health. Also, a nutrition conversation is really, and these children should focus on balance. So I really want to get away from talking about good foods or bad foods, but just focusing on a balanced diet for your children.
Yes, and encouraging regular meals with the family if possible. Encouraging making sure you're eating enough fiber and protein. We know that helps you feel full for a longer period of time as opposed to things like sugar sweetened beverages or foods that are high in sugar.
Yeah. And Dr. Waldman, I know you have a nutrition background. So how do you tell parents to talk about nutrition to children in general? Because we don't want to talk about restriction and food policing because that often backfires. But what do you typically say?
This is a hard conversation because certainly there is a fine line between going overboard and not saying enough. And I think even as a parent, we toe that line very often. Like you said before, it's really not talking about necessarily labeling good food and bad foods. It's about balancing it. It's also about encouraging your children to get involved in that meal planning, taking them to the grocery store with you, picking out what fruits or vegetables this week do we want to try? Do we want to cook together? Something that looks interesting to you, right? Not necessarily making the same thing over and over that they hate. We know that encouraging new foods can be really hard, but it takes a while for kids to get to the point where they will try something, will like something. So getting over that frustration as a parent is really hard.
Yeah. And talk to us a little bit about medication. Sometimes lifestyle changes alone are not enough and medications are appropriate. And so what's your take on medication for type 2 diabetes for kids?
Absolutely. I think they're a really important part of this treatment. Yes, we want to make sure that we talk about the nutrition, the lifestyle, the movement, the sleep, but There are patients that need medications, and there's no getting around that. And there's absolutely nothing wrong with that.
The first line medication that we typically use for children for type 2 diabetes is metformin. And metformin has been around for many years. It really focuses on helps to improve insulin sensitivity. So how well your body's own insulin is working. And I've used it in kids as young as 10 who have type 2 diabetes. Sometimes I really haven't seen that diagnosis come up, honestly, before the age of 10 for children. I don't know if you have, but it often is very safe and effective for children with type 2.
Yes, I always go to that first line as well. And we do have a second line medication, which is those GLP-1s, and that can be considered in our type 2 pediatric patients. I've used them very often in this case, and they do work very well. Talking about them with the family, coming to a decision again as a family, whether to try it, I think is really important, talking about the potential side effects. And I think we'll probably have another episode focusing more specifically on these medications, but just knowing that they're absolutely a potential treatment for type 2 diabetes.
Absolutely. Yes. And a medication is not a failure, it's a tool. And we have been supported by all the major societies, including the American Academy of Pediatrics, to really offer some of these tools, these medication tools for our patients, not just for diabetes, but for weight concerns as well. It's really important to understand that medication can and sometimes is necessary. And children with type 2 diabetes often experience some stigma related to their weight. And really important to focus on a non-judgmental tone, not blaming the child, not blaming another parent with that diagnosis. Because, like we said before, sometimes it's genetically predisposed, and there's so many factors that are involved in reaching that diagnosis of type 2.
And we know that blame is not going to help, right? So using words matters, or language matters, and really focusing on health is what I like to do, right? We are not focusing on the number on the scale. We're focusing on your health right now and your health lifelong. And that's what's really important to this.
And really, again, early intervention really dramatically can improve outcomes. We talked about mental health as part of type 1 diabetes, and we talked about how important that is. But for type 2 diabetes, mental health is also a critical part of the care, and sometimes mental health for the whole family as well. We do want to focus on that, but early intervention can really improve outcomes. So if you've tried for a long time and said our child is given a diagnosis of prediabetes or diabetes, and we've tried with lifestyle changes and we just don't know what else to do, really important to see a pediatric endocrinologist to see how we can help and guide you.
And to know that those small changes still chill, right? So they increase over time. Don't get frustrated. Keep going on your journey. We know that it is really hard and can be frustrating at times, but we as pediatric endocrinologists are here to support you the whole way through.
Right. And type 2 diabetes can be serious, but it's not a personal failure. So just make sure you understand that. And like Dr. Waldman said, with the right support, children and families can make meaningful and lasting changes. Thank you for listening to the Endo Kids Podcast. We will have future episodes focused on some of these medications that are used to treat type 2 diabetes and weight in general. But thank you for listening.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.